The urinary bladder is seated in our lower pelvis and is a muscular urine reservoir. The urine is produced by the kidneys and is collected. The ureters drain the urine from the kidneys into the urinary bladder. The bladder can easily accommodate to amounts of 300 to 600 milliliters of urine. The urge to void occurs at about 200 milliliters. In urinary retention, the bladder can hold up to 1,000 milliliters of fluid. The bladder is seated in the lower pelvis, directly behind the pubic bone. The empty urinary bladder is hidden behind the pubic bone and is contained entirely into the pelvis. The full bladder widens into the lower abdomen. The size and the position is varying with the amount of fluid in it. It is important to know the neighboring structures of every organ we scan with ultrasound to get a good orientation. The adjacent structures of the urinary bladder in the male pelvis are the prostate, the rectum, the pubic bone, and the peritoneum, which means the bladder is lying extraperitoneally. In the female pelvis, we have the uterus, cervix, and vagina as neighboring structures, posterior to the bladder, the uterus, also lying superior to the bladder, especially when it's empty. And again, anterior is the pubic bone, and inferior, we've got the pelvic fascia. Now that we've got an imagination of the position of the bladder, we go on and take a look at the ultrasound approaches. To be able to scan the urinary bladder is really helpful to get a quick diagnosis, for example, for urinary retention. If a urinary catheter is in correct position, or if there's residual urine, which can, for example, cause recurrent infection. For scanning the bladder, we again need our curved array transducer, and we need a patient with a full bladder to be able to assess the organ, especially the bladder wall, because when the bladder is empty, the bladder wall is contracted and we can't thoroughly assess it. So we ask our patients not to void before our examination, and we even can give them about 250 milliliters to drink about 20 or 30 minutes before the examination. Our patient is lying in a supine position. What should the urinary bladder look like in ultrasound? Since it contains fluid, we expect an echo-free, means black organ with a white border, the bladder wall. To assess the bladder wall is only possible when the urinary bladder is reasonably filled, as I already told you, because only then it is unfolded. The bladder has got a kind of rectangular shape in the transverse plane, a more triangular shape in the longitudinal scan. As always, we scan the organ in two planes. The thickness of the bladder wall, when filled, should not exceed 4 millimeters. The wall should be regular, without any circumscribed or diffuse thickening. And there also should be no free fluid found in the Douglas cavity in females or in the rectovesical pouch in male patients. Our first view of the urinary bladder is the transverse suprapubic view. We place the transducer shortly above the pubic bone in a transverse position, and we have to tilt the transducer behind the pubic bone so we get a transverse view of the bladder. Note that the mark of the transducer again points towards you. In this picture, we see the urinary bladder in the transverse scan, and it contains fluid, so the content is black, and around it we can see the bladder wall, which is regular, which is hyperechoic, and we can easily distinguish it here, and we got a nearly rectangular shape of the urinary bladder. This is the right side of a patient, this is the left side of a patient, this is ventrally, and this is dorsally of our patient. The next one is a video clip of a transverse scan. And we can detect something over here. What do you think? This is this colored structure, somehow moving. It is the urinary inflow of the urine of the urethus into the bladder. I start with a transverse scan. I place my transducer at the lower abdomen, shortly above the pubic bone. Remember, the mark is pointing to outside in order that we got the right picture. And then, as you see, it is necessary to tilt the transducer a little bit behind the pubic bone in order to get a good view. And here, in the middle of a picture, we got a beautiful urinary bladder. Now let's orientate on our picture first. We remember the mark is pointing to outside, and the mark here on our monitor picture means the left side. So that means here we got the right side of a patient, because the mark is pointing towards us. And here we got the left side of a patient. At the bottom of our picture, we got the dorsal structures, which are quite far to our transducer. And at the top of our picture, we got the ventral structures. For example, the abdominal wall, subcutaneous tissue, and the abdominal muscles. Now that we have orientated ourselves in our picture, we can start to assess the urinary bladder. As you can see, in the center, we got the dark fluid, because fluid is echo-free in sonography, or should be echo-free. So the content of our bladder is black. At the border, around the center, which is the fluid, we got the bladder wall, which is quite bright because it has got a high echogenicity. As you can see in a transverse scan, the urinary bladder has a nearly rectangular form. Again, we place the transducer shortly above the pubic bone, but this time in a longitudinal position. And in the midline, again, it will be necessary to tilt the transducer caudally in order to get behind the pubic bone. So in this picture, we got the longitudinal scan of the urinary bladder. And now we can see it has somehow a more triangular shape. And again, the content is black, and around it we can detect the bladder wall, hyperechoic, clearly seen, and there's no free fluid dorsally of the bladder. So this is a perfect view of a normal urinary bladder, reasonably filled in a longitudinal plane. Here we got a video clip. This is a female patient because here we got the uterus. This is a longitudinal scan again. The dark content, black content, the fluid of the urinary bladder, and this thin, regular bladder wall, hyperechoic around it. Again, another video, and here we can detect once more the urine inflow from the urethra into the urinary bladder. Beautiful. And now we want to turn into the second plane, into the longitudinal suprapubic view. Our transducer stays at the lower abdomen, and I turn the transducer clockwise around 90 degrees until the mark of my transducer points to the head of the patient. And as you can see, we again have to tilt our transducer behind the pubic bone. So here we can see the urinary bladder in a longitudinal view. For better orientation, we start again to see where we are on our monitor picture. We remember the mark is pointing to the head of our patient. That means the left side of a picture are the cranial structures. The right side of a picture are the caudal structures. The top of our picture are again the ventral objects, like the abdominal wall. And again, we get here the dorsal structures. What is important to assess when we scan the urinary bladder? I start again in the transverse view. What is beautiful, I can show you some artifacts here. The fluid in the middle has no echogenicity, so it should be black. But sometimes, as we can see here, there are some artifacts, so-called reverberation artifacts over here. As you can see, these are quite parallel lines over here. And this is because the ultrasound beam is repeatedly reflected between two surfaces. It is important to know that, to distinguish that from pathologies. Okay, first thing we assess is the content of the urinary bladder, which should be black. Sometimes we have got artifacts, like over here again. But there should be no other content in it. No coagulated blood, no tumors, no pus, no sediment. So how can I distinguish sediment or pus or blood from artifacts? When we have sediment in the bladder or blood, it's always seated in the deepest place. Means we would find it over here. And there would be no parallel lines, but some kind of a mass at the bottom of the bladder. The next thing we want and have to assess is the bladder wall. It should be no thicker than 4 millimeters. Let's try to measure it here. Just optimize my picture. Here it's about 2 millimeters. Maybe we take another measurement over here. Here it's about 3.1 millimeters, which is totally normal. Next, we have to look for irregularities of the bladder wall. There should be no wall thickening, no irregularities, no diffuse or circumscribed thickening. What we can see here is no irregularity. It's the ostium of the ureter, the right one, and here we can also see the ostium of the left ureter. This is totally normal. So we thoroughly scan the bladder wall, look for any irregularities. There are none. This is a normal urinary bladder.